And just a quick review of the numbers as of late afternoon yesterday. Let me start off quickly globally, and then we'll go to the United States. Right now, there are 129 countries that have involvement with coronavirus. Globally, the numbers are 132 plus thousand. So it's a little bit more than 132,000, about 7,500 of which are new cases. Importantly, and this is something we've mentioned over the last couple of days, that if you look at what was formerly the main feeder of this coronavirus outbreak was China, they have 80,000 or 81,000 new cases, but only 11 new cases and only 7 new deaths. Things have switched over now to outside of China, which has actually triggered our decision, the decision of the president, to do the travel restrictions in other areas besides China. And I think it's important to recognize that, because when this is all over and it will end, you will see a curve of how the coronavirus outbreak evolved. It's not going to be a unidimensional or homogeneous, because countries are going to do this and then that. We've seen it already with China. We're starting to see it with Korea, which brings us now to what we can expect in our own country. So if you look at the domestic cases, there are about 2,226, including the repatriations, 50 deaths, 532 new cases, and 9 new deaths, which means we have not reached our peak. Now, we will see more cases and we will see more suffering and death, predominantly, as the vice president said, among the vulnerables in our society, the individuals with the conditions that we spoke to and the elderly. But built in that is a challenge. And the challenge is we still have the opportunity to influence the course of that curve. So what we would like to see is that when this is all over, our curve was not like that. Our curve was like this. So that's the reason why we're implementing the things we're talking about. And finally, I just want to make a comment about yesterday. You know, as a physician, which is what I primarily am, who takes care of patients every day before I was doing this, is that there are things that happened yesterday that I think are going to be really important to the people out there who are going to be impacted by this, but particularly by the physicians. And that is the president declaring a state of national emergency, because that will be what I thought the word that I use, essentially unshackling us from any of the things that are going to get in the way of our implementing, particularly the new powers giving to the Secretary of HHS, Alex Azar, and the departments within his agency, particularly CMS, which you're going to hear about shortly. And within that group, particularly the nursing home situation, which we've really got to protect. The other thing is, we always get asked about testing. You saw the CDO out there. Now it's all systems go. Let's look forward. The responsibility is going to be with us, but also with them, because as we get knowledge about new testing, we'll alleviate the anxiety that we have in the world about we don't know what's going on, but it also will give the individual physician and individual citizen the opportunity to know where they stand. I'll stop there and happy to answer questions later. Thank you.
Thank you, Dr. Fauci.